Okay, here's a picture representation of all the B vitamins. I've got the numbers of the B vitamins and what their deficiency means, the names, things like that. The B1 vitamin, or B1, is thiamine. That's why you've got big thighs, thiamine. And this is also called beriberi, which is often associated with alcohol and Wernicke's syndrome. So all those going to beriberi, alcohol, B1 deficiency, thiamine. You've got a couple different ways of calling this. When you get CNS problems, it's called dry beriberi. So you've got this, cactus on here for dry. When you get heart problems, it's called wet beriberi. You've also got you can get muscular problems. You get CNS or GI problems, gait disturbances, which you can say is part of the the big thighs or something. You also can get fluid in the lungs. So lethargy, fatigue, heart problems, CNS problems. It can be a big problem, and the big thing, all they need is thiamine in their diet. Add a B vitamin, and it could take care of all the problems they're getting, the forgetfulness, the senior moments, it looks like, and it could lead from alcoholism. Vitamin B2 has got the riboflavin, and I love how flavin's on there too. It's flavor. It has a lot of the problems with the deficiency has to do with the mouth. So it's often caused by inadequate diet or impaired liver function. Diet or liver function. You get a sore throat. You get the esophagus being red over here. Redness, swelling of the mouth and mucosa. Chelosis, which is the cracking around the lips, or stomatitis, which is the cracking of the lips themselves. So these all have to do with vitamin B2 or riboflavin deficiency. Vitamin B3 is also called niacin or nicotinic acid, one or the other. Hey, I'm Nick Pellagra. Well, Pellagra is the name of the actual disorder. Pellagra has 4 Ds. Now, there's no vitamin B4 that I know of. So I did 3 plus 4 Ds. So remember, there's 4 Ds of Pellagra: diarrhea, dementia, dermatitis, and death. So diarrhea, dementia, dermatitis, death. In no specific order, but if you have a patient that presents with diarrhea, dementia, dermatitis, you start asking questions about their diet and what's going on. They do have a sensitivity to light. That's why he's wearing sunglasses. You get alopecia, edema, things like that. But in the most part, it's those 4 Ds. Over here, B5, you got a pan associated, panthothetic acid, pantothetic acid. Either way, I didn't find a lot of information on deficiencies. Not a big deal, so just know what it is if by chance you need to identify B5 as pantothetic acid. B6 is pyridoxine, B6, and there's a pi on there, so if I remember pi, that pi is this one, pan's that one, I'm good. But B6 you get a lot of like B2 seizure or cheilitis, but you do also get seizures and irritability. So the irritability is that the mouth doesn't even want to deal with the seizures, the waviness. So you get seizures, irritability, and cheilitis, which is the dryness around the edges of the mouth. Now, B7 is also called biotin. You got the Tin Man here. So, tin, I can remember that, biotin. You get, with biotin deficiency, it has a lot to do with cosmetics. I had a hairdresser, tell me to start taking biotin products to improve my hair. I mean, so it's things like that, nails and hair, skin. And so you're going to get dry skin, seborrheic dermatitis, fungal infections, rashes, alopecia, fine brittle hair, so it's breaking. So all those things are part of what a biotin deficiency is. B9. I kind of try to turn it into a horse, but so it's a full 9. Ha, joke, full 8. So it's something to pay attention to. Mainly it's talked about with pregnancy, because a deficiency in folate can during the pregnancy can cause spina bifida, neural tube defects in pregnant women. So that's kind of the thing. And taking folate when you find out you're pregnant is usually late. You find out 3-4 weeks after conception, and by the time the neural tube develops, it's in the first 4 weeks. So it's kind of like a moot point. You should take it, but try to make sure you talk to your patients about taking folate before they even try to get pregnant. And B12 causes a lot of problems. It gets a bad rap when it comes to vegetarians, because it really is hard to have B12 deficiency due to diet. It's usually caused by pernicious anemia, which is the parietal cell destruction. You get no intrinsic factor, which is what you need to absorb vitamin B12. But you get paresthesia, so you got to get this tingling in your extremities. Ataxia, you have a hard time walking. Deep tendon reflexes are, a little hammer there. Now, this is a foot coming off here too. It's a positive Babinski sign. So you get paresis, which is loss of movement. So all these things have everything to do with vitamin B12, and you better check for pernicious anemia.